Today's topic for Coffee Talk is having PRP in the eyebrow area. Is it possible? It's absolutely possible, and we do it a lot. So why would you choose to have PRP injected into the eyebrow area over having... So there are some clients who are unsuited to having any kind of an eyebrow tattoo done, either by microblading or by microblading blade and shade. And we have found that, now it's very age dependent, but we have found that some people would far prefer to see if the eyebrow hairs will grow back rather than having a tattoo done to the area. Certain people who have very sensitive skin usually don't receive the eyebrow tattoo very well. So therefore, in that instance, we would actually suggest to them to know would they like to give eyebrow PRP a go. So anybody who has lost or have noticed that their eyebrow hairs are starting to disappear, you are at that critical cusp to try see if PRP will work for you and your eyebrows. If you've had no eyebrows all of your life, or if you had a very poor eyebrow all of your life, well then they're not suddenly going to grow. But if you did have a good eyebrow once upon a time and you've noticed that they started to deteriorate, well then injecting the eyebrow area with your own PRP is a brilliant way to go. PRP, platelet-rich plasma, is rejuvenative aesthetics. So it's where we take a sample of blood from your arm here, spin it in a centrifuge, draw off the platelet-rich plasma, it's full of growth factors, and we inject it into the eyebrow area, whereby it wakes up the cells to do what they always did. So what would we suggest that you do in advance of having this treatment done? So for about a month before you come to us to have the PRP to your eyebrows, we oftentimes suggest that you use minoxidil 5%. Now that is minoxidil that we are also recommending for head hair loss. But it's the serum and the mousse that you could brush it through your eyebrow hair every night for about a month to see if that'll make a difference. If your follicles are open to stimulation, well, then we'll know that it will respond to the PRP. There are clients that come to me and they have PRP or cellular matrix of their face because they're very sensitive to all other type of aesthetic treatments. And if we have some left over and I notice that their eyebrows are starting to get a bit sparse, I don't waste it, obviously, but I would offer to put it into the eyebrow area, as I did with a recent client, and her eyebrow hairs have grown. So it works. So this lady is 52, 51, 52-ish. So it's it is very age dependent. I wouldn't have this treatment done if you're well into your 70s or early 80s, because the follicles, I think, have given up the ghost at that point. Now, oftentimes people had asked me to know what size is the needle that I use and is it terribly sore. So I have my little trusty lips here that I use for demonstration purposes. But this needle here, this needle is used to give intramuscular injections, which are into your arm for your vaccines, pain relief, that sort of thing. It's a green needle, it's quite big, it's large, it has to go into muscle. Then we have the next one, which is intradermal. It's really, really tiny. You can barely see it. I don't know if you can focus there. And this is the one that we use for putting PRP into your eyebrows. So you can barely see it. It's so tiny. In fact, I use this a lot. And if you want any further information in relation to PRP of the eyebrows, we can do PRP everywhere. We can do it on your face, we can do it on your neck, we can do décolletage, backs of hands, around the eyes, eyelids, underneath the eye if you're looking for rejuvenation, used with PRP, platelet-rich plasma, which is full of stem cells and growth factors from your own body. All right, reach out to us by email and we'll send you the information back for free. And then you can decide whether this is the treatment for you or not. All right, I hope that helps. Bye.